recently offered a nerve block or you just read about it and you would like to know what it is? Hi, I'm Dr. Grass, I'm an anesthetist, and let's talk about it. So basically we have two kinds of major areas of anesthesia. There's general anesthesia, which basically you get medications by your veins and systemically you go to sleep or get medication to forget, for drink pain, or neuromuscular blockade, which is blocking the function of your muscles. And that's called general anesthesia, and sometimes you get all of these four pillars or sometimes some of them. And there's many surgeries you need to have general anesthesia for, and you cannot do it in a different way. For example, major abdominal surgeries or very painful and risky surgeries. But for some other surgeries, you can have your surgery with an anesthesia called regional anesthesia, which basically means the following. The pain we experience is formed by our perception of the environment and also from the pain stimuli we get from our organs. And this pain stimuli arrives at our brain for us to experience it by some sort of cables that we have in our system called nerves. So instead of giving medication for you not to experience this at the level of your brain, just like general anesthesia does, we can block these cables or nerves from bringing this painful stimuli to you. And that's basically what regional anesthesia does. It's anesthesia, but it's regional and not general. So what we do is we inject a medication called local anesthesia, which we deposit around one of these nerves that's relevant to the area of the surgery you're having. And this way we block these electrical impulses to arrive at your brain. These medications are called local anesthetics, and between them we have lidocaine, bupivacaine, and some others. How do we get this medication to be regional and not general, to arrive around these nerves? So what we do is use a needle and approximate that needle to your nerve and inject this medication around it. So you can be having a surgery totally under regional anesthesia. And the most widely known and old is neuraxial anesthesia, which is epidurals, which many women get for labor, and spinal anesthesia, which many women get for C-sections, but also for orthopedic procedures and all kinds of different procedures. And that's the most strong regional anesthetic technique that we have. We have other blocks that are called peripheral at the level of the nerves, which is more distant from the central system, which is the spinal cord, which we block when we do a spinal anesthesia or an epidural anesthesia. This medication is deposited around this nerve by a fine needle that we advance with the help of an ultrasound machine. And this allows us to look at your nerve, the needle, and the other tissues, for example, arteries, veins, and other structures that could be risky to touch with the needle. Depending on the surgery that you will have, we will decide which specific nerve we will block. For example, we can block the femoral nerve, the sciatic nerve, and we can even be more specific. So according to each surgery, we will decide which is the most appropriate block. So we can end up doing a whole surgery just on a spinal anesthesia or just on a block or a combination of both. But why would we do both if we're already blocking the relevant nerve? Because spinal anesthesia is a very, very dense block. And this block doesn't allow you even to move your legs in general. So that would limit your capability to go home early. And we would like to get you home as soon as possible, provided you're comfortable, but without significant pain levels. So I know what you're thinking. This sounds scary, right? Because they're gonna put a big needle in my skin and I'm gonna experience pain. But what we do to make you feel more comfortable, we first freeze your skin with the local anesthesia as well, but a smaller needle, so you're comfortable before we proceed with the bigger needle for this block. So the objective would be to get you as comfortable as possible with the least possible amount of pain, with the least possible amount of side effects from other medications such as morphine that cause anhydromorphone, you probably heard of that, or oxycodone, which sometimes causes nausea and vomiting, or constipation, itching, etc. So that's the idea, to reduce these side effects, make you feel comfortable, and sometimes helping you arrive home earlier. Thank you. If you have any questions on what I talked or something you would like me to talk about, please write it in the comment section below. Give me a like, subscribe, and let me know how I can help. Thanks.